My name is Dr. Lakshmi Sundararajan. I am one of the pediatric surgeons at Kanchi Kamakoti Child's Trust Hospital. Today, I would like to talk about a use of laparoscopy for surgery in children. Now, what is laparoscopy? It is about doing an operation, making small holes in the body through which we introduce long instruments and then do the operation inside the body for that. Now, commonly laparoscopy is done for conditions related to the stomach, intestines, kidneys, urinary operations, and we can also do laparoscopy in the chest where it is called thoracoscopy. So we can do operations on the lungs or other conditions inside the chest using laparoscopy. Now, why is laparoscopy important? Because the operation that we do inside the body is exactly the same as the operation we will do with an open surgery. However, when we do it with laparoscopy, the incision pain, the cut is very small. So the children don't have the pain of the incision. So they recover that much faster, especially for operations which are involving removal of an organ. For example, be it appendicectomy, be it removal of a kidney, removal of a lung portion, whatever. There the actual procedure is straightforward, but the organ is very deep inside the body. To get that access to that area, we have to make a big cut on the body, and that a lot of the pain of the operation is because of the cut. So when we do this laparoscopically, the child stands to benefit with not only less pain after the operation, faster recovery after the operation, but also later on they don't have the big scar. They will have small cuts which may not even be visible in future days. Wherever there is a possibility of doing an operation laparoscopically, then we should try to see whether it will be suitable for your child. Of course, laparoscopic operations means we need to have the special equipment for that. We need to have the child-sized equipment for that according to the age of the child. Not all centers will be able to afford that, so it is important to check on whether those kind of equipment are available in the place where you want to take your child for surgery. The other important thing is laparoscopy in children requires more care and delicate handling of tissues compared to laparoscopy in adults. So again, it is important to know that your surgeon is having the requisite expertise for doing laparoscopy in children. Some surgeries may have the same amount of pain or the same recovery, whether we do it laparoscopically or open surgery. In that situation, the only advantage will be a smaller scar. But there are other surgeries where the incision pain will be much more than the actual pain of the surgery and taking out of that particular part. In those situations, laparoscopy has got a huge benefit in terms of recovery of the child. So it is very important that when your child is needing any operation, you should inquire with your surgeon whether or not that same operation can be done laparoscopically. What is the expected recovery for the child if the operation was done as an open operation or as a laparoscopic operation, and whether that facility for the laparoscopic surgery is available in that particular center. Now, there is also talk about robotic surgery in children. Definitely, robotic surgery has got its own place. But in a lot of children, the robotic instruments are much bigger than what the laparoscopic instruments will be. So with the laparoscopic surgery, the operations may be done with 3 mm or 5 mm instruments, whereas the smallest robotic instrument is 8 mm, so that much bigger. So robotic does not always mean that that is a better option for your child, but it is important to inquire about the various options available and then decide what is best for your child.